Caroline Fanti is the Director of Regional Surgical Services at Thunder Bay Regional Health Sciences Center. Her educational background includes a master's in health management, completion of the Rotman Northwest Lynn Health Leadership Program, an honors Bachelor of Science in Physical Therapy, and an honors Bachelor of Science in Human Kinetics. Caroline's passion lies with the development and implementation of innovative, regionally integrated programs and best practice models of care for patients in Northwestern Ontario. Programs such as centralized intake, rapid access clinics, remote patient monitoring, and bundled care leverage the efficient use of resources, virtual care, and interprofessional care teams to connect patients with the most appropriate specialists, provide the right care at the right time, support admission avoidance, optimize patient flow, and ensure personalized transitions of care. Through successful engagement of urban, rural, and remote health system partners, Caroline has played an instrumental role in regional care system planning in order to champion capacity building and intelligent health system transformation. Caroline, welcome to the show.
Thanks, Alan.
Hey, Caroline.
Thanks, Joshua. Really happy to be here today.
Amazing. We're so happy to have you on the podcast. Just to set the stage, Caroline, so Thunder Bay Regional Health Sciences Center is in the northwestern part of Ontario. Could you tell us a little bit about the patient population that you serve?
Sure. Yeah, absolutely. We have quite a unique geographical area in that we are the size of France, but we serve about 230,000 people. About 115,000 of those live in the Thunder Bay proper and within an hour's radius of Thunder Bay, but another 115,000 people live in other smaller communities that are, one would consider rural, and then many of our populations are also quite remote. So it really presents a health service challenge in terms of providing care close to home, timeliness, equity, and access to services, and also recruitment and retention challenges for all kinds of health providers in the Northwest.
And Caroline, just to unpack that a bit more, a lot of organizations and providers, did more virtual care as a result of the pandemic. Given how your population is so distributed in the Northwest, before COVID, were you doing more, virtual care than some other regional health programs?
Absolutely. We actually made an application to the ministry to fund our program a little bit different, recognizing how remote some of our populations are and how spread out. I think people from the GTA may not recognize that some of our patients travel the distance of Toronto to Kingston or even Toronto to Montreal for care on a fairly regular basis. And that's easier said than done when you consider our climate as well and the highway infrastructure. So really some significant access challenge, winter roads, a lot of air travel, which can be extremely impacted by weather. So we have been quite aggressive in offering virtual care probably since at least 2017. Mm-hmm.
So I guess you weren't maybe as unfamiliar to the rise in technology in the past years, maybe some other places, but obviously it wasn't being used all over the place all the time just yet.
So the remote care monitoring platform caught my eye, I think in about 2018, and I was very interested in pursuing it. But as is often the case in healthcare, people may love an idea, but finding the funds to be able to support it is always the challenge. And that's where the pandemic has really offered up the opportunity for us to finally launch remote patient monitoring. So we're thrilled. This is something we've had our eye on in terms of innovation and vision to better support patients for a long time. And it's really exciting to be able to implement.
So Caroline, we partnered SeamlessMD with Thunder Bay Regional and your team to implement Seamless as part of your surgical remote monitoring program during COVID, even though you'd been thinking about it for a couple of years in advance. Maybe for folks who aren't as familiar, you would think that everyone would be familiar with surgical remote monitoring by now, but you never know, right? How do you describe it to patients and team members for someone who's unfamiliar?
I think remote patient monitoring is really a safety net that supports the patient for their entire surgical journey, from pre-op, during their hospital stay, and post-op. They are connected to their care team at all times through the app. Remote care monitoring also supports self-management, which I think is a really critical element of the future of healthcare and getting patients to engage and really be invested in optimizing their care journey with what they can do themselves, but knowing that if they need support from the care team, it is so accessible through the application that Seamless has provided us. And patients are able to connect with us through a phone, through a tablet, through a computer. And if they're not tech savvy, they can be supported by a family member that could possibly be connected through the app. Where it became really relevant was many of the patients that we're supporting during the pandemic have a need to access care, but they were fearful too. A lot of them felt vulnerable. They may have been our more elderly or senior population, and they were very reluctant to access the healthcare system. Remote care monitoring has allowed us to provide as much care as possible within the comfort of the patient's home. It's enabled us to provide surgery as a day surgery instead of as an admitted patient, or at least if they are admitted, to really shorten their length of stay, knowing that they were being discharged home with full connectivity to the healthcare team. That has brought a lot of comfort to our patients, given them confidence in being able to access the care system in a way that protected them the most. And again, from pre-op throughout their hospital stay and post-op.
Kind of reminds me, I remember last year, maybe a few months after the pandemic started, a friend of mine works in an ED here in Toronto, and she was saying how they were concerned because patients stopped coming into the ED because they were afraid of picking up COVID, but then maybe they end up having another problem instead, maybe an untreated, acute illness that gets worse because they didn't come in, and they actually wanted people to come into the ED. So what you said kind of makes a lot of sense. And I guess another thing I'm wondering is, you talked about how this sort of program can maybe shift more inpatient surgeries to same day. Al and I have heard from other providers we work with that part of the way that they use something like Seamless for that is to maybe give more confidence to patients and the care team to discharge maybe half a day or a day earlier, knowing that, hey, we're going to check in on you the next day through the platform. Is that how you think about it in terms of getting more same day surgery possible, or is it a sort of a different perspective that enables that?
No, it's absolutely patient confidence in being able to go home, especially in our area. They're going home to an area that could be quite far away from their care team. We're talking hours. And they may even be hours from a smaller community-based hospital that isn't even the Thunder Bay Regional Health Sciences Center where they had their procedure. So definitely this is a confidence builder, and we know that the better patients are prepared prior to surgery. We're not just preparing them for surgery, we're preparing them for discharge home. And the Seamless app, in terms of self-management and providing patients with all of the information that they need in terms of reminders and the ability to connect with us rather immediately or send us alerts if they need to, has been instrumental in helping the patient mindset with discharge home, recognizing that it will improve the safety of their experience.
That makes a lot of sense. Maybe Alan, we get to segue, talk to me more about the team at Thunder Bay behind making something like this possible.
Actually, prior to doing that, I'd just like to quarterback on something that you said leading into that question, Joshua, and that was with providers being concerned that people are avoiding the emergency department. And we did actually have a patient that had gone through a knee replacement surgery and was being supported by Seamless. And our nurse practitioner that's supporting the application picked up that the patient was experiencing some atypical symptoms. She immediately contacted the patient and encouraged her to go to the emergency department. And the patient was quite reluctant, really needed a fair bit of convincing to go to the emergency department in our community. And fortunately she did, because she was diagnosed with bilateral pulmonary emboli, which can be a very life-threatening condition. So we've only implemented, as you know, about 6 months ago, and we already feel that Seamless has saved a life.
That's amazing.
It really is.
It's one of those things where I'll tell you maybe a related story, Caroline. It doesn't involve technology, but just involves kind of better knowledge and communication. So, we had a previous team member here at Seamless who had his partner's, I think, grandfather had a surgery done in a different province. And because he had worked at Seamless and he learned about all the kinds of warning signs and symptoms after certain procedures, when he heard his partner's grandfather was having these signs and symptoms, it was early signs of a blood clot. It was his encouragement that got his grandfather to go actually get it checked out. And yes, it was pulmonary embolism and got treated right away. But it's the fact that he had that knowledge because he worked at Seamless and was involved in implementing it and learned all the symptom tracking. But 99% of the population doesn't have that sort of clinical knowledge or experience. And so the fact that we can actually make it easier for patients to track those things and identify them, that knowledge is power. So thank you for sharing that story. And it's one of those funny things, Caroline, where I think we always joke, we hope you never need Seamless because that means you're pretty healthy and you don't need this kind of support. But you know what, if you have in a healthcare condition where you do, we hope you get it, so thank you for sharing that.
Yeah, I mean, we've got many of those stories. That's just one. And I think as we try to clear the surgical backlog, this is going to be critical. If we can shorten length of stay and the amount of acute care resources that are required, we can get more patients through. And right now with a significant backlog, that's going to be a game changer.
Yeah, absolutely. I think I was seeing the report from April. It's about maybe 250,000 surgeries in Ontario they estimate to still be backlogged, and hopefully it's starting to go down, but it's going to take quite a bit of an effort, as you said, to make it happen.
Absolutely.
Yeah. So Caroline, like with anything in healthcare, the team is super important, and I think it's not just one person that's leading the initiative. It really requires the entire team to be bought into the impact that the technology could have if it is a technology innovation. I'm curious, in terms of this SeamlessMD innovation and the other innovations you've made around virtual care during the COVID period, how did you rally your team around that?
Rallying to get support around this was really much easier than I anticipated. You always think change management can be difficult, but everyone intuitively saw the logic in this platform and the benefits that it could bring, particularly during the pandemic. So from a leadership perspective, buy-in was easy, and really traction with our surgeons. This is really something that we were bringing to the surgeons that would enhance the circle of care that we were able to provide to their patients. Fortunately, Ontario Health set us up for success in really making it mandatory that we provide two-way support to the patient. So it's not just about providing them information through the app, but it's also the connectivity to a healthcare provider and the fact that we have a nurse practitioner attached to every patient. And we also have a designated clerk that can monitor the alerts and then quickly notify the nurse practitioner if a patient needs to be contacted. So really the two-way connectivity is instrumental. And we've had patients undergo a hip or knee replacement during COVID prior to our implementation of Seamless and have their second hip or knee done during COVID, but with the benefit of the Seamless app. And the feedback we've gotten is unbelievable. They said it was absolutely a transformational experience. It was night and day in terms of how supported and how positive it was.
That's fantastic.
I mean, Carol, maybe just to add on to that, we've certainly seen some of the patient comments, and a big thing, it hasn't actually just been a technology. It's the patient saying, well, Skylar and others from your team actually, using the platform to monitor me as a patient and check in on me and help me catch things earlier. So I think one of the things that Alan and I've learned is the technology, I guess you need it if you want a remote monitoring program, but the people behind it and how engaged they are to actually use it to its full advantage have been really important. And that segues well actually to another topic. Thunder Bay, your team has had really fantastic patient activation and engagement with the platform. I think the numbers we've seen is about 95% of patients are activating and using it, and well over 80% are kind of doing those regular post-discharge symptom check-ins on the platform. You're doing something right for sure in terms of encouraging and getting your patients to be engaged with something they're unfamiliar with. Often they're older patients too. Is there anything special that you think your team has been doing in terms of educating and motivating patients to be engaged with this sort of platform?
It's a multifactorial answer. I don't want to brag, but we have a really engaged, phenomenal team across the board. We were able to launch this first with hip and knee. We've got, as I mentioned, a really visionary, cohesive, and collaborative team. So surgeon support in launching the app was tremendous from the get-go. And we were just able to recruit Skylar Christian as our first nurse practitioner, Stephanie Vincent as our second, and our clerk is Brittany Dezaki. And they are also invested in the platform and what it means for transforming patient care, because they see it day in, day out. They're getting the positive benefits, not only of the technology and what it does for patients, but also working with your team, Joshua and Alan. I mean, the professional staff that you bring to support your technology has really been a game changer in terms of responsivity and the energy, the professionalism that's been brought. I think the success that we're having is your team and my team combined. What else can I say to that? Really, the app is giving us such opportunity for interprofessional engagement. Our nurse practitioners are working with our anesthetists in the pain service to make pain management really leading edge and optimal for patients. And that in itself really transforms the immediate perioperative period for patients. They're having so much less pain because of those relationships. The surgeons, we're giving them, courtesy of Seamless, you're sending us monthly reports and they're getting to see the feedback from the patients. It builds morale. It's kind of, all these wins feed upon each other. These success stories build a team up and they help us on the days when there's challenges.
That's awesome. Yeah, I really appreciate the kind words. I think, not to brag on Aaron either, but I think one of the things that we've done differently, but well, is we've kind of designed our team to be a little bit like a healthcare organization. So, I mean, yes, we have, business people and engineers and designers and what you'd expect in a software company, but about a quarter of our team actually has come from the clinical world in some way. So they've come from health literacy, or they've been, a pharmacist or other clinical experiences. And so from the very beginning, we've kind of, had this sort of healthcare DNA in the company in different ways. And I think that's helped us build a lot of, empathy internally in the company, so that, even like every week on Mondays, we have our all hands. One of the things that we always do is actually go through a couple of patient positive comments in the past week, but then also a couple of constructive patient comments in the past week. So that way we can celebrate some patient story wins, but then also realize, hey, we still got work to do to make the patient experience better. And I think the other thing that we've done is, as part of our hiring process, it actually really matters to us that the team really cares about our mission with regards to improving patient care. Because I think, just like you, Caroline, I think folks who work in an organization like yours, unless you're genuinely passionate about making patient care better, when times get tough, which especially during the pandemic, even before the pandemic, there's tough times in healthcare. If you don't have that genuine passion for improving patient care, it's hard to be resilient, because, I mean, better than I do how frustrating healthcare can be, but rewarding it can be when you can, make a difference. So I appreciate you saying that. Could you?
Yeah, I'll just make a comment on that. I think one of our most challenging customizations was our colorectal pathway, just because it was such a large group of surgeons. You're trying to get consensus from 8 surgeons, which isn't always easy. But the fact that Seamless has already established colorectal pathways with some pretty credible institutions across Ontario and beyond, we can say to the surgeons, hey, we're not starting from scratch. This isn't Seamless's first rodeo. And the professional services is someone with a healthcare background and health literacy background. And one that expedites our learning curve and allows us to customize the platform and arrive at decisions as a collective so much faster. Mm-hmm. So it's really quite efficient.
That's wonderful. Actually, something else you mentioned earlier caught my ear. You talked about how part of this process has been getting, the team together and having the interprofessional team collaborate more. One of the things that we've heard in the past with some of our partners has been when you implement something like Seamless, you're trying to standardize a lot of your protocols and instructions on the platform. And then when you get, nursing and physicians and allied health professionals in the room, we start hearing, oh, you've been telling the patient this, I've been telling them something else.
Yeah.
Have you seen that happen at all when you've been implementing something like this?
Oh, absolutely. I mean, we're customizing our spine pathway as we speak, and that involves both orthopedic spine surgeons and our neurosurgeons. We're a group of 5 on that team. And obviously, you want to let surgeons have autonomy of practice and respect their own nuances to clinical practice. But it's also given us the opportunity to meet as a group and say, hey, where does it make sense to standardize and give patients the same message? And where does it make sense to deviate? So that really has been a great process for us.
Excellent.
Wonderful.
Caroline, I'd love to know a little bit about what the patient feedback has been from the program. Maybe if you could talk a little bit about what the impact has been on patients, and then if you have any anecdotal stories of what patients have said about the technology.
Yeah, well, I'll start at the beginning. I'm just an earshot of our clerk that actually rosters patients. And so I can hear how the conversations go with that initial phone call. Patients are truly excited to hear about this opportunity and that they're going to be supported through the care pathway. So onboarding patients, like you've said, I think we're at 94 or 95% success. And that's really significant considering the patients we serve are rural and remote. And so accessibility can be an issue, but we're also serving a lot of seniors who may not be entirely comfortable with technologies as much as our younger generations are. So adoption has been tremendous. And where the feedback has been amazing to watch is that patients are able to give feedback to so many different healthcare providers. When they send a thank you or they provide feedback to our team, it's touching the pre-admission clinic, it's touching surgical daycare, it's touching the OR, it's the ward, it's our nurse practitioner, it's our seamless clerk, and it's our surgeons. And they're getting very specific messages from the patients, which again, I don't know anyone who isn't going to like that.
Mm-hmm.
On a related note, in terms of actually, like what Skylar and the team does in terms of, monitoring patients and all that, that can sometimes be or not sometimes, it probably was like a very new workflow, right? How did your team decide, like what would merit getting an alert or getting a flag and having Skylar kind of reach out? Was that an iterative process? Was it clear from the start? No, these are the 5 things we want to keep an eye on.
Yeah, it was a learning process. At first, we set our alerts with too much sensitivity, and we quickly learned that we were sending patients a message to go to the emergency department too quickly. But I would way rather err on that side rather than actually not have it sensitive enough. And then we worked with Seamless to change the messaging, and really Seamless supported us very quickly on changing the alerts. Very much a team decision. You really do have to work with your pre-admission clinic and your surgeons on what triggers an alert, and then fine-tuning the language around that, which Seamless brings the expertise with the health literacy and making sure we're speaking at a level that our patients will understand, and making sure that we have the right language, and that if we're not recommending the ED, that we have the support mechanisms for them to reach out in an alternate way. And we've been able to decrease our return visits to the emergency department and decrease our admissions by a significant amount. I know our return visits to the ED are down 50%.
Wow, that's amazing.
Yeah, and that, to me, that's just tip of the iceberg.
Mm-hmm. Yeah,
and I guess I was going to say real quickly, I guess this is particularly important for your population because patients live further away from the ED than maybe where Al and I are in Toronto. So not having to go to the ED, but also still have equally good quality of care and outcomes matters more, so that they're not traveling. I don't know how long, might be 2-3 hours for some patients to go to an ED. That must be really important.
Oh, absolutely. As I mentioned, to the northeast of us, patients could live 4 to 5 hours away from the hospital site that they had surgery at. I think what's exciting about Seamless and in how it supports our our program, though, is we have a lot of pathways where the surgeries are done out of 4 different hospitals for hip and knee replacement, 2 different hospitals for spine surgery, 2 separate sets of hospitals for shoulder surgery. And we've been able to customize those pathways very specific to where the patients live in their communities and where they're receiving their surgical care. And, even though we're centralized as a program, we're decentralized in how we deliver care.
Right.
I know you've, unfortunately, because of the pandemic, I think I've read that some patients from Manitoba even had to get care at your hospital. Have you yet at this point had to monitor a patient who's gone back to Manitoba or a different province, or do you ever see that happening at some point?
That's a great question, Joshua, and that's something we're actively engaging Ontario Health with, in that we've been able to support Manitoba in treating patients in our intensive care unit, patients that are critically ill. And we'd like to, if necessary, and if it makes sense, to support Manitoban patients that are critically disabled, recognizing that some of them live only 2 hours away from one of our hospitals that offers hip, knee, and spine surgery in Kenora. We know Manitoba had a critical surgical backlog prior to COVID, and again, it's been exacerbated. So those are early conversations. And again, the priority will be to clear the Ontario surgical backlog, but we've got operating room capacity out in our regional centers. And if we really leverage that, we could probably help beyond our own provincial borders.
That's really fascinating, because it almost feels as if virtual care is one of those tools that actually almost, I don't say shrinks, but it makes the healthcare system truly more connected, even nationally here in Canada. I mean, who knows? Maybe depending on what Thunder Bay specializes in for certain types of care, it actually might be better for the patient to travel a bit further, go to Thunder Bay to get that specialized care, knowing that, hey, when I go home, the same care team who knows what my surgery or condition was can keep an eye on me. I think you've seen better than we have the problems where if a patient has to go back to a facility near where they live, but that team doesn't have the context around the surgery or something else, you might miss something. So it's been amazing to see how, this sort of experience can keep the same care team connected with the same patient and probably catch something earlier that would have been missed.
And that opportunity has been twofold. So one, it's allowed us to expand this, the type of surgical cases that we can perform safely in our smaller community hospitals. So during the pandemic, Lake of the Woods kicked off being able to offer less complex spine cases, which is critical. I mean, Lake of the Woods is 5 hours from here, and their access to care for certain services was typically dependent on them being able to cross the provincial border to Manitoba, which has been closed. So they had no opportunity. So not only can we bring the surgery to them, but when we have to bring a Kenora patient to Thunder Bay Regional for certain procedures based on their health profile or the type of surgery, they at least know that when they're returning to their small community, they're 5 hours away from their surgeon team, but they're supported through the app.
That's amazing.
Yeah. So Caroline, you were talking a little bit about how the platform seems to have contributed to a reduction in ED visits already during the first 6 months of the implementation. You were saying that's maybe just the tip of the iceberg, which I think is really revealing. I think a lot of programs start to view the data that's being collected by a digital patient engagement platform or surgical remote monitoring platform as kind of like this extra benefit where they can then learn from the data and improve the program over time. So I'm curious, have you had any insights so far from the technology and the data that's been collected?
Oh, absolutely. So our data would be even better had we started running our ED visit report on a daily basis. We've now done that because we've had some patients that were going back to their local emergency department a few hours away from our tertiary care hospital for simple things like dressing changes or blood thinner injections. Because in our small communities, that's where they find their primary care provider. Their primary care provider is often supporting the emergency department. And so it's used very differently than an emergency department in a tertiary care center. So, we've had patients go back 6 or 7 times to the emergency department, which you would think there was a major problem going on post-operatively, but they're going for something simple like a dressing change or a blood thinner injection. So we've tightened up our wound care pathway and the dressings that we use. And then we can put those people on an oral blood thinner instead of an injectable if they're not comfortable with self-injecting. So we are now running those ED reports every day rather than waiting for a patient to have 6 or 7 emergency visits, because really it's not ideal during the pandemic to have a patient present to the emergency department for a non-emergency visit. And it's not great use of healthcare resources either. So if we can support them remotely by slightly tweaking our pathway, that's what we're doing. And so now we call patients. If we've seen them have one emergency visit, our nurse practitioner or our clerk calls them and says, how can we better support you? And is there something we could be doing remotely?
Right.
Caroline, early on, you talked a lot about the importance of collaboration among interprofessional teams. I mean, one of the things that your team has been early adopter of has been this Ontario Health SeamlessMD kind of user group, where Thunder Bay and other early adopters of surgical remote monitoring have kind of come together, I think, on a monthly basis with someone from Ontario Health and someone from our team to kind of maybe share best practices and collaborate on how we do monitoring better together. Could you talk a bit about what is this user group, what happens?
Someone from our LIN in our Ontario Health Northwest, Karen Malench, saw the great work that we were doing at Thunder Bay Regional, and then we started reaching out to other hospitals in Ontario Health North, including Sudbury, Sault Ste. Marie, and others. And we're really trying to learn from each other and not reinvent the wheel and not spend extra time and professional resources doing the same work when it already exists. So we're sharing ideas, but we're sharing work effort as well. Simple things like job description and how are you running your two-way model? What type of health resource are you attaching to the platform and why? Other things like translation services. We're looking at provincial procurement so that we can decrease the cost of being able to offer the app in multiple languages that are relevant to each community.
That's amazing. And yeah. All those funny things where, we do work both in Canada and the US, and I would say we see some collaboration in the US, but one of the challenges in the US sometimes, different hospitals in the same city, or let's call it competing for market share, which is not really something you hear in Ontario or Canada. And in Ontario, because you're not in that sort of environment, you naturally, I think, will collaborate more with your local, organizations. And I think that's really, really refreshing, that you can just organically just collaborate. So that's really wonderful here. And the other neat thing is that it started in the Northwest, but I think we've seen some, non-Northwest Ontario hospitals also join into the user group and share too. So it's really helped make it truly a provincial collaboration, which is very exciting.
It really is. Yeah, we meet with the entire province. So being able to share lessons learned and critical success factors has really shortened everyone's learning curve and shortened the amount of time it takes to get everyone up to speed and be really innovative. It's really about knowledge translation and sharing.
Amazing. Alan, did you have any other topics or questions for Caroline?
Yeah, I had one last question for Caroline. So I know you shared that one story about the patient and the blood clots being caught early. Without violating PHI, could you share any specific patient stories that you know of, maybe aside from that one, or anything else that you've heard from patients?
Yeah, we actually had a patient that was actually no longer on the platform. They had just passed the 4-week post-op mark. They'd had a hip replacement, and they had a kind of a minor slip up on some stairs. And they went to the emergency department and had an x-ray, and it was read as normal. And the alert still crossed and was picked up by our nurse practitioner. Somehow she was alerted, and even though the patient was more than 4 weeks post-op, just slightly, our nurse practitioner actually reached out and asked the patient how they were doing and felt that what they were reporting indicated that they weren't doing as well as they should be for 4 weeks out. And so she reached out to our surgeon, the nurse practitioner did, Skylar, reached out to our surgeon who looked at the x-rays that were taken and noticed that the hip replacement had actually subsided and that there was a minor crack.
Oh, wow.
And the patient needed revision hip surgery. Otherwise, they would have fallen and further broken because the implant was no longer stable. So really that pickup wouldn't have happened without Seamless and without our nurse practitioner. And then one of the other success stories was supporting a patient that developed a bladder infection. And we all know how sick and confused patients can get with a bladder infection post-operatively. And care was expedited. The patient was started on antibiotics. And that patient had really favorable feedback for Seamless, for Skylar, and actually wrote to our organization to thank Thunder Bay Regional for having deployed this app.
Oh, wow. That's amazing. I almost feel as if your team is setting like a new standard of care. And it's one of those things where and until you actually experience it as a patient, you probably never would have thought that your provider would keep this close of an eye on you after you've left the hospital. But now that we know that it's possible, it's just amazing. It's funny because we started this about 8 years ago, but honestly, we were really early. And now that, stories like this kind of come up more frequently, it's amazing to hear. We appreciate you sharing that, Caroline. Thank you. And kudos to your team. I mean, again, like the technology is one thing, but if you don't have great execution the way your team has had, you're not going to get the outcomes your team has had. So amazing work. Congratulations.
Thanks, Joshua. I think what I'm really excited about is that my expectations were high and they've been met. Yeah. So it's actually delivering on all the metrics I kind of expected it to, but needed it to, right? And so for me to be able to say like this is doing exactly what I hoped for is pretty awesome. Especially bringing about such positive change during such a difficult time in healthcare. Our orthopedic surgeons have always been quite visionary. And for us to be able to share the success and really share it through strong data, like these aren't just anecdotal stories. We have strong data that the Seamless app provides us on a quarterly basis. We've been able to share that with all of our other surgical services and say, this is what we're doing. And instead of us having to reach out to other surgical groups and say, would you consider being a part of this? It's the other way around. They are coming to us and say, when is it our turn for customization of our surgical pathway? And when are you going to have capacity to take on more surgical pathways? So I think that in and of itself speaks for itself.
Yeah. I think it's a really powerful point, Caroline. It's one thing to try and just tell other, team members, hey, can you get on board with this? It's show them the data. Data is often the most powerful way to move people. That's a really great point.
Absolutely.
Yeah. Awesome. So Caroline, I think I mentioned it before the podcast. At this point, we're going to jump over to what we call the Fast Five. Basically 5 questions just to get to know you a little bit better for our audience.
And this is where I should have prepped, but didn't.
Yeah, but that's okay.
The good news is you can lie for all these questions and no one's going to know the difference.
You can make it up. All right. So question 1 that we have, what is your favorite book or book you've gifted the most?
I have to laugh because I'm really hard pressed to make it through an entire book. I often lose interest halfway or 3/4 of the way through, with the exception of The Help. I absolutely love that story.
Yeah. That's a great one. All right, that's good. Question 2, how has an apparent failure set you up for greater success?
Yeah, I think it's through applying for different positions that I actually was not the successful candidate for, that actually supported leadership in the creation of this role for me as Director of Regional Surgical Services for Ontario Health Northwest. I trust the universe. Things worked out beautifully for me.
That's great. Yeah.
Actually, do you mind if we ask you a bit more about that? Because that's a really important role, and I mean, you start off, I guess, more clinical, Caroline. Not everyone wants to go to more, leadership and administration. Where did that motivation come from? Was there a certain turning point where you said, you know what, I want to do more leadership administrative stuff, or was it just a over time a natural evolution for you?
Yeah, I was working full time and raising 3 sons, but recognized that if I wanted to advance my career, I needed to pursue my master's. So I did do my master's in health management through McMaster University, which is really an allied health degree in conjunction with their DeGroote School of Business. And as I noted, I've also done some leadership work with Rotman. And those are really transformational experiences for me from a formal education standpoint, but also working clinically and being able to make such an impact one-on-one with a patient. Really, my passion is health system transformation, and I wanted to make an impact on a broader level than just one-to-one clinical care. As much as I love that piece, I wanted to affect system change. I really want a viable healthcare system for our youth, for future generations. Like I said, I'm raising 3 boys, and I've learned through my master's that we're spending more and a bigger and bigger percentage of our provincial budget on healthcare. We can't keep throwing more money at this. We have to spend better, and that's what really drives me, is making sure that care is top quality and accessible and timely for patients, but also that it's efficient and effective and sustainable over time. Personally, decades ago, I had difficulty accessing the healthcare system when I had a need, and that really marked me. I was able to navigate the healthcare system because I was working in it. But I think of all the people that don't know how to navigate the healthcare system. We have to make access equitable, available, and no door is closed for our patients. It has to be really easy for them to know how to access their care team, and that's what Seamless does.
That's fantastic.
That's a long answer.
That was amazing.
Great
that
answer.
was like the quote for the podcast right there. Fantastic. All right, question 3. Would you rather have super strength, super speed, or the ability to read people's minds?
Oh, yeah, I would never want to be able to read people's minds. I think super strength, that I think
Okay.
being resilient is really important.
Yeah, I like that, because it's not always just applying to physical strength. It's, mental fortitude and resilience. I love that.
Oh, absolutely.
Question 4, and this may be actually related to another answer you already gave, but what is something in healthcare you believe that others might find insane?
I don't know that I believe in anything that others might think is insane. I really think it's the transformation, though, that we've done in getting patients to have the mind shift around self-management and the importance of getting home quickly. I mean, when I started this position, length of stay was easily 7 days or more for a basic procedure, and patients thought that being in the hospital was the right place for them. But as the superbugs come out, and we recognize that getting patients home as fast as possible is actually what's safest. Now everyone is starting or has already adopted that. But when we started, the amount of resistance that we got in telling other healthcare providers and patients that going home sooner was better, that took some time and some convincing.
Yeah. All right, last question that we have, and this is a COVID-19 related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
I've always had really healthy habits, but I think I've just really redoubled my efforts on holistic health, probably more yoga, and finally getting around to doing some meditation.
Perfect, yeah.
Certainly not, I can't say it's daily, but certainly have explored more the holistic health piece.
That's great. Yeah.
And also the nutrition that goes along with it. I've done a lot of reading about the gut microbiome and how, the decisions we're making on an everyday basis is really setting up our DNA for success or failure with chronic disease.
Yeah,
very true.
Well, Caroline, that's all the questions that we had prepared for the episode. I do want to
Are you
thank
ready
you
for mine now?
Yeah, yeah, sure, if you want.
Yeah,
We're
no,
always
I'm just
open.
kidding.
That's good. But I do want to say thank you for coming on the podcast today. You shared an incredible amount of wisdom with our audience in terms of what Thunder Bay is doing with surgical remote monitoring, but then also how you've used the platform to learn and improve for the future as well, and how you've actually rallied your team behind this innovation. So I think that's very valuable for our audience to learn, and I know I've learned a lot today. So just want to thank you for coming on the show.
Thank you, Caroline.
Yeah. Thank you both, Joshua and Ellen. I mean, you made it so easy for me. It was really comfortable and conversational. So I want to thank you for the opportunity. I hope I've conveyed how passionate I am about this type of work, and hope that can be shared with other decision makers, patients, providers.
Fantastic. Awesome. Well, thank you, Caroline.
And nice to see you face to face finally.
Yeah.